Hi, I'm Dr. Carfagno, and this is Trevor, my physiologist here at Scottsdale Sports Medicine. I'm an internal medicine, sports medicine physician, boarded and trained at the Cleveland Clinic Foundation. I've been in practice for 22 years, involved in a variety of different capacities in sports and sports coverage. We have a unique setting here in sports medicine where you see internal medicine, orthopedic sports medicine, and more so with the well-rounded athlete, exercise physiology and sports nutrition. So a lot of the folks that we see are weekend warriors, or they're getting ready to go get active, all the way to the elite athlete. Now, one of the things is we take a leadership role in the health and fitness field, accounting for all different types and subject matters for sports and exercise fitness medicine. One of the things I always stress is that we see the elite athlete, but we transcend a lot of that evaluation to the everyday person. And that includes a lot of the internal medicine that we see. So heart disease, diabetes, COPD, high blood pressure, you name it. We apply those same principles and very, very thorough evaluation to all of them in a capacity that you can imagine. You get about 5 different institutes at one time. So we have some questions we'd like to address.
Yeah, so Dr. Carfagno, we've been working together for a couple of years now, but what is your personal story with healthcare and what drives you each day to be a physician?
So I started out, I was an undergraduate at Arizona State University. I played some college football there, and I was a personal trainer. And basically what I did with that, I envisioned at some point I wanted to have a gym. And I wanted to have a place where I could send athletes and train them. And when I got into medicine, I wanted to create an integrated approach where you have the evaluation at the university level, and that meets the medical community level. So I had this practice here for 18 years. We've been noted as being one of the top physicians for the last 11 years straight because of this evaluation. It's a unique approach. So.
Yeah. Awesome. And then what led you to adding the DEXA technology to your practice, and how do you currently incorporate that with our healthcare that we incorporate today?
So DEXA scan, I think, is believed to be one of the gold standards of evaluation. And we trained with caliper and body impedance and underwater body weighting. But to have the gold standard, I wanted to always have that. That's the way I look at all the different types of testing in medicine, is what is the ultimate way you want to diagnose an entity. In addition, I do a lot of metabolic bone disease evaluation, so the bone density on the DEXA scan is also ideal to evaluate osteopenia. And in the DEXA scan, it's for body fat, but also sarcopenia, decreased muscle mass loss, as opposed to decreased bone mass loss. So it's great for all populations.
Yeah. And then for the general public that may not be familiar with the DEXA, what data, insights, and health markers does a DEXA scan provide? And how does it help your patients take greater ownership of their health?
So a DEXA scan is a great tool. Obviously, we use body mass index, which is based on the World Health Organization for people's body surface area, weight over height squared. So you don't need a DEXA scan for that. However, what the DEXA scan does is it takes through their absorptiometry technology to take a look at the mass in square centimeters, soft tissue, fat, and lean mass. And so it can give numbers that can equate to medical conditions, such as obesity or such as even diabetes, for this matter, being November Diabetes Awareness Month.
And how does DEXA technology differentiate us here at Scottsdale Sports Medicine, do you think? And what programs do we offer the DEXA with?
So the DEXA is used, and it's sort of a central component to almost lead and get folks motivated. So we use it with a variety of different evaluations. From a weight loss program, we do trending with that before and after. Again, we look at soft tissue mass, lean mass, fat mass as they change, as people get in better shape, they lose weight, they also get better control of their diabetes. We also do a muscle mass gain, so people who want to gain weight, whether they're athletes, off-season, or even people who have undergone a condition such as a neurological disease or even orthopedic issue or surgery, or they need to increase their muscle mass. We can do trends with that and see. We also use it with medical conditions, so say like diabetes. The visceral fat, which is very important, has a good correlation with the A1C, as many are aware. That's an average sugar reading. as a nice evaluation to see that's related to metabolic disease and diabetes, so we can pick things up earlier on with the DEXA scan.
And then, so many people are familiar with the DEXA and how it can be used for detecting osteoporosis, but we use it for body compositions a lot here. So how have you evolved your business standpoint to involve the body composition here at Scottsdale Sports Medicine?
Again, it's a central component that really is, like it's said, it's a very efficient, highly accurate test that takes literally just 5 to 10 minutes for a client or athlete. And that can really be something that motivates them, all types of athletes, again, whether they're getting started with a program or they are an elite athlete or they have, like I said, a medical condition that we can trend and track with some other biometrics.
Yeah, and as you've already mentioned, November is Diabetes Awareness Month. How dangerous is visceral adipose tissue, and how does a DEXA scan help everyone better understand their risk? And what are some things that you might tell a patient to help lower that visceral adipose tissue?
So some of the literature suggests that this visceral adiposity, which is really the fat in the organs, it's not the subcutaneous fat that we see typically around the belly, but it's that dangerous fat that has a relationship with insulin resistance. There's about a 0.8% relationship for every 50 square centimeters or so, depends on the literature you read, of your visceral fat. So the more control that you have over your diabetes, all right, you're probably going to see better A1Cs, better sugar control. You may see better visceral fat. So we do see, it's one of those sort of red flags that we'll see on a report, like we talk about with some folks. It says their body comp may look okay, but their visceral adiposity may be something we need an action plan. Plans on that, a lot of the things, again, lifestyle changes, diet, exercise. In the exercise literature, we tend to remotely go to a lot of high intensity training, interval training. You can imagine but also the biggest thing is to get people just more active in general. And the same thing with the food, is being a eucaloric, meaning keeping their calories at balance, and maybe dropping their carbohydrates in phase 1, which we do with our metabolic program, but with the active-based lifestyle, and then gradually refeeding them. So that tend to do very well. We've had literally hundreds and thousands of athletes and patients do that.
Yep. And lastly, as you just said, you've obviously helped many patients transform their health and optimize their health over the years. What is unique to your approach, and what is something that maybe a quick tip that you give somebody starting their journey in pursuit of fitness and health?
Great question. I think the biggest thing you want to do is just buy into, breaking a routine and building a routine of being active. Don't call it exercise, just be more active throughout the day. The old school of the American College of Sports Medicine, 3 to 5 days a week, or 150 minutes a week, it can be a little bit intimidating for some big populations. So if you can just stay active, be spatially aware of where you're at, and that's one thing. That's going to help with calories burned, and may help with some of the control with the diabetes and the fat deposition. And then the 4 components of exercise we always teach all our patients: cardiovascular, strengthening, balance, and flexibility. All of those tend to decrease as you age, but also are not being accounted for. So we try to promote a healthy exercise prescription, as we were both trained in undergraduate.
Awesome.
Thanks.